Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just joining us, we are talking about lip health as well as canker sores and fever blisters. Express Care's Dr. Jitka Lom is here giving us some great tips on having healthy lips. Doc, let's get now to some of our viewer questions. We mentioned this before the break, but Vanessa from Totu asks, are cold sores contagious?
They are. Again, they're caused by the herpes simplex virus, and the little blister that you see is full of viral particles, and when it breaks open, those spread to you and to other people. So if you have a cold sore, cover it with a little Vaseline and try not to share food or kiss other people.
And so this is in addition to her question, but you know, some people, you get a pimple and you pop it.
Yeah.
You warn against that, right?
Yeah, don't pop it because you're breaking the thing and letting the particles spread. So just keep it covered and leave it alone. It'll shrink and the blister will go down by itself.
Okay, Jonathan from Assen writes, can excessive exposure to the sun trigger cold sores and fever blisters? And you touched a little bit about this earlier.
Yeah, it can. It's a good question. The reason is that you're asking why, because when you are in the sun, your lips will get very dry and hot and also a little bit cracked, and there'll be little sharp edges that the viral particle can attach onto. Same thing with stress. People will tend to lick their lips a lot, which actually is very dehydrating because your saliva, you know, it has a lot of salty material in it. So you actually will dehydrate yourself by licking your lips all the time. So yeah, so you can definitely trigger it off by sun and stress.
Now, I was reading as I was researching this, the skin on your lips is actually the thinnest on anywhere else on your body. Is that true?
Yeah, the lips are actually what's called a mucous membrane. We have others that are sort of the lining of our eye and the inside of our nose, our mouth, and the lining of our private parts, so on. So those are called mucous membranes, and they're very, very thin and sensitive.
Okay,
yeah.
Moving on to our next question. It comes from Mark from Manila. How long does it take for a cold sore to clear up without any sort of treatment?
Well, it might take up to 10 days, and it's pretty uncomfortable, scabbing and sore, so it's helpful if you take some medicine or apply something topically.
Okay. Sean from Jigo asks, can cracked lips be a sign of dehydration? And we did touch on this earlier.
Yes, definitely. So if you're seeing that you have cracked, dry lips, drink more water per day. You should drink at least the proverbial 8 glasses of water, but in our climate, double that because it's a hot island, and especially if you're outside perspiring, you'll need more than that. The way to tell is if your urine is clear colored, then you're drinking enough.
All right, I gotta go drink some water after this. All right, Lonnie from Mighty asks, will using chapstick regularly help me have soft, healthy lips?
It will help. Again, choosing a lip balm that is just very pure, maybe with some lanolin or petrolatum, and avoiding a whole lot of chemical additives, fragrances, and colors.
What about beeswax? I've seen some of the,
it is very helpful.
Bird's beeswax.
Yeah, very nice, very helpful. Just avoid the mentholatum and other camphor and those type of very fragrant, smelly kind of additives. Those are usually not helpful.
Okay, those are the ones that are going to dry your lips out. All right, Sally from Inarahan asks, what can I do to make my lips look more plump, and is it safe?
Well, drink your water, and then there's a couple of things. One of the things that makes our lips very moist is a material called hyaluronic acid, which is actually a protein that's found in all of our cells. And what it does is it attracts water. And so when you have a lot of hyaluronic acid in your cells, you will have very plump lips. And they sell lipsticks and lip balms now that have hyaluronic acid that you can put just on top to attract water just to the surface of the lips. And they feel a little tingly when you put them on. And then you can also do injectable hyaluronic acid. And those are procedures like Restylane and so on, where you actually inject that material into the lips. Then that material absorbs water and plumps them up.
And the last part of our question is it safe?
It's totally safe. This is a material that is biologically inactive. It's exactly the same thing that your own body makes, so it's very safe.
All right, any last tips that you want to give to our viewers out there as they're going to be puckering up tonight?
Stay safe.
All right, Doc, thank you so much. Now, a few weeks ago we told you about a special contest, and we are happy to announce the winner. And who is the winner?
It's a lady named Andrea Kaplan, and she'll be coming in to have a treatment to plump her lips, so you can watch that in a future show.
All right, well, good. Congratulations, Andrea, and we look forward to showing you that in an upcoming segment. Definitely. Dr. Lom, meanwhile, will be back next week. She'll be answering your questions on the amazing river, the bloodstream. Send us your questions to healthyliving@KUAM.com, or of course you can post your question on our Facebook page or post a comment on our website. There is more Healthy Living to come. Stay with us.